Okay, I'm here to talk about academic portfolios. And academic portfolios are a mechanism to describe what you do in your job as a faculty. There are lots of different ways to describe what you do, and there are different situations in which each of these forums is appropriate. A bio sketch is just a list of publications and presentations. A CV has a little more detail on it and often has committees, descriptions of what you contributed to each publication. And then an academic portfolio has much more than that, and that's really what we're going to talk about today. An example is you would use a bio sketch to apply for a grant. A CV you would use if you're applying for a job or if somebody's nominating you for an award. You also use your CV for promotion, but really the academic portfolio is what you're going to use for the majority of promotion issues. And you're also going to use the information in your academic portfolio for your yearly evaluations. An example, here is the citation that you would see on a bio sketch. Basically, you just have the authors, the name of the paper, and where it was published. In a CV, you would also see a little bit more detail. You would highlight your name out of the list of authors, and you would also put underneath what contributions you made to this publication. The academic portfolio would have both of those in it, but also maybe a little discussion of how this paper came about. Was it a description of a study that you did? In this particular situation, this was a paper that I wrote with several junior faculty and to determine whether we could help new faculty write in an easier manner and help people get more publications. So the academic portfolio presents that in addition to just the citation. So what is an academic portfolio? So really it's a collection of materials that describe your academic work. Again, different than a CV, tends to include some reflection or evaluation, which your CV does not include. And so it's really much richer than just a list of publications and presentations. The goals of an academic portfolio, and I apologize, this slide is a little dense. Number one, to demonstrate the breadth of learning, teaching, and research that you've done, to evaluate achievement of your intended outcomes. So this is a place where you really can showcase what you've done. You can show your best work, you can show evaluations. It's a place you can reflect and assess your own educational experience. You can include pieces that show your evolution as a teacher or your evolution as a clinician. Helps make connections between where you start out as a new faculty and where you've come as a mid-career faculty. You can illustrate the learning process. You can also share your expertise by including some of the best work that you have done. The four basic processes that go into the creation of an academic portfolio. Number one is collection. You want a collection of materials, and I usually recommend that people start out with more because you can always get rid of things. You can always take things out of the portfolio, but you want to be comprehensive to start out with. Your selection. Why are you creating the portfolio? Who's going to read it and why? Reflection, thinking critically about your learning, teaching, and research experiences. And then connections, really making meaningful connections between your teaching, your research, and your service and community experiences. And this last part, the connection part, is going to help you further on when you're working toward getting promoted and you're writing a personal statement discussing your body of work. So the portfolio is really something that's going to evolve. You're going to add new items. You might take some out once every year, once every 6 months maybe. When you're updating your CV, you want to update the portfolio as well. What a lot of people will do is every time they do a talk, they'll just put a copy of that talk into their portfolio. Every time they get evaluations for teaching or clinical work, they'll put it in their portfolio. Again, it's easy to take things out, but you want to start out with as much to make this collection of materials as rich as possible. So Medical College of Wisconsin, on their faculty development website, has an excellent description of an educator's portfolio. And so a lot of people use these 10 areas as the basis for their academic portfolio. So, and I'm just going to go through them quickly, and then we'll talk a little bit more in detail about each one. The first is philosophy of education. What's your personal theory of learning and teaching? Why did you become a faculty member, as opposed to just being a clinician? Curriculum development, instructional materials, design, development, evaluation of curriculum and programs, your teaching skills. This is the place where you would keep most of your teaching evaluations, any extra training you go to learn more about teaching. Assessment of learner performance. So if you're going to write test questions, if you have a pre and post test in one of your courses or your lectures. Advisor, you want a list of your formal and informal advisees and any kind of leadership and management and education that you have participated in. The last four, educational scholarship, continuing education, honors and awards, long-term goals. The long-term goals section is a section that a lot of people work on probably once a year as they look at what they've done over the previous year and think about what they want to do over the next few years. And this long-term goals section also goes along with the annual review that most people have, where you talk about goals for the coming years. So how do you get started? Really, you want to clarify what your responsibilities are as a faculty. Start selecting items for the portfolio. Prepare statements on each item. For example, and again, you might just put a copy of slides that you did for a lecture, but you also might want to put a little note in there saying, this worked really well in this lecture, this didn't work very well, I tried a new technique of a case-based lecture instead of just me talking, that kind of thing. Arrange the items in order, compile supporting data. You know, there are things in your portfolio that you might say, wow, I should actually put that in my CV because I don't have that in my CV now. And then think about how physically you're going to present the academic portfolio. And we'll talk about that a little bit later. So when should you start compiling your academic portfolio? So most people will say day one of your job. Day one of your job, put your job description in your academic portfolio, and that's the first thing that goes in there. It's really a work in progress. You can use as a storage space, and you should evaluate it yearly at the least. A lot of people will do every 6 months. And some people will, every time they do something and every time they add something to their CV, they'll add something to their academic portfolio as well. So a lot of people find this first section, the philosophy of education or philosophy of clinical work, one of the more difficult ones to fill. If there is an article that you read somewhere, an essay, a podcast, a TED Talk, that really resonates with the way you think about teaching and learning, that would be a good thing to put in your academic portfolio. You'll be able to reference it in the future. You can put personal experiences, fiction, quotes. It's a good time to really think a little bit more about why you are a faculty. And this is definitely something that's evolving over time as you get more experience and as you learn more. Curriculum development, instructional materials. This section, you're going to have copies of talks, a curriculum, handouts, manuals, CME, anything that you create. Even you could put patient education materials that you create in here. This is sort of just a grab bag of everything that you are developing. Teaching skills, no matter how many times you say it, it's really, really, really important to save all resident and student evaluations, all evaluations of lectures, teaching awards, any direct feedback. You get an email from a student, you get an email from somebody who came to your CME talk. That's the perfect thing to just toss into your academic portfolio, and you'll go back and look at it later. Assessment of learner performance, pre and post test, again, questions. If you're an advisor for a medical student, a resident, colleague, nurse practitioner, if you're on any mentor committees. Educational clinical administration, if you're a course director, a rotation coordinator, you're on a medical school or residency committee, keep a tab of these committees. I know everybody's on a lot of different committees, but you want somewhere to have a notation about how much work each of these committees are. So then when you look back, you'll have a richer description of what you did in the past year or the past 2 years or the past 6 months. Educational or clinical scholarship, all research goes here. Grants, if you write a grant, whether or not you get it, put the copy of the grant that you submitted in your academic portfolio. Put the reviews in your academic portfolio, the scoring, so that even if you don't get the grant, and if you don't get a grant, that grant is not going to be on your CV or your bio sketch, but at least in your academic portfolio, there will be some evidence of all the work that you put into writing the grant, and that certainly is not wasted. And continuing education, a lot of people will, especially if they go to a course that impacts and affects the way that they're teaching and the way that they're working as a faculty, we'll just put conference brochures. If there's a talk that you find really interesting and really resonates with what you're doing, put a copy of the slides in your academic portfolio. You just don't know when you're going to want to go back and reference those. Journals, listservs, if there's a post that you find really interesting that really correlates with something that you're doing, some research you're doing, this would be a perfect thing to put in the continuing education section. Honors and awards, obviously a description of the award, how it came about. And then long-term goals is really when you look back year to year, ends up being sort of a professional development journal and will be very helpful. If you keep up with this, will be very helpful when you go back to write a personal statement going up for promotion. So how to get started? We can go as low-tech or as high-tech as you want. And a lot of people will really do both. I usually recommend that you just buy a big accordion file because there are things that still come in paper. Make 10 tabs for the 10 different areas in your academic portfolio, and then just throw stuff in there as a conference brochure that you go to that you have notes on. Put it in a file. I also usually recommend that people have electronic folders, whether you keep email folders or just web-based folders. That way you can put electronic evaluations, you can put emails you get, you can put podcasts, listservs, anything that you do electronic, so that you have sort of a dual capacity academic portfolio. Ideally we would have everything electronic, but in reality there still is paper that kind of gets moved around. And so a lot of people will do both of these just because it does make it easier as you're going back. There are a couple of really good websites that will give you sort of a step-by-step example on how to put together an academic portfolio. In addition to these two, I would also recommend the Medical College of Wisconsin, and I think I have the website on a previous slide, but their faculty development website provides excellent guidance on how to start developing your academic portfolio. Thank you.